If you're a dentist and you hear the term case acceptance and you think it's about being salesy or pushy or recommending treatment to patients that they don't need, then you're already losing. See, most dentists think that to get more treatment acceptance, it's about getting patients to say yes to things, when really it's about understanding why they say no. Dentists deal with the most anxious patient population, I think, of any healthcare field. They're not just anxious about the procedure itself. They don't have, they have PTSD about pain from a root canal they had back 20, 30 years ago when the dentist didn't use any lidocaine, or it was 3 visits to get the root canal done, or they had trauma from a tooth extraction. They're also anxious about the finances. Am I gonna be able to afford this? And how much is it gonna be? What's the cheapest option? And they're also just straight up anxious about maybe being judged, right? Sometimes it's not the fact that they're scared about the treatment and they're not scared about the finances, but maybe they haven't been to the dentist in 5, 10 plus years. And the last guy they went to pretty much told them that, their teeth are garbage and that they all got to get pulled out. So treatment acceptance is all about the patient experience. It's about understanding why patients say no and making the patient comfortable, not just with being with you in the chair, but that you are the authority and everything you're saying is trustworthy and that you're an honest person. See, it's not always about getting everyone to just agree to treatment or doing the crown that you recommend. It's about being honest. I can recall many times where I've had patients where they tell me they want something done and I'm just straight up honest, like, hey, this is a waste of your time and money. You may get 2% greater result. Or, hey, if we go in here and do this, you're actually gonna get more increased sensitivity. Or, hey, this denture that you have that you're wanting me to remake, I actually think it was done pretty well. I maybe can only make it a hair better, right? In these cases, patients appreciate the honesty. And that denture patient example I just gave you, not only did he in real time, thank me for my honesty, but he ended up coming back to make the denture anyway, right? So to think that you have to push patients to do things, it's quite frankly, you're just gonna ruin your brand, right? Because patients aren't dumb, people aren't dumb. They know when they're being sold something, they know when they're sold something they don't need. And by trying to push them to do something, you're just not only turning them off, but when things don't go well, you're setting yourself up for a lot of headache, right? Buyer's remorse, lawsuits in the worst case scenarios, right? How many times have you done a crown on a patient and they have increased sensitivity afterwards and they come back to you saying, doc, look, why did we do this crown? The tooth was completely fine before you touched it. Why did you push me to do this? Especially when they're paying out of pocket or they're spending $1,000 to get it done. So these are all things that you have to learn how to navigate and manage, right? Because treatment acceptance is not just about, getting the patient to say yes. It's about knowing who to accept as a patient as well. Case selection is extremely important. There's times you come into the room, you talk to this patient, and you may notice something's off, right? They have super unrealistic expectations. They're not listening to anything you're saying. They're being uncooperative. These are red flags. You have to, as a provider, notice red flags and know when to refer. That's the beauty of being a general dentist, right? You have the ability to refer patients out. If you feel like something's off, you better off sending it to the prosthodontist, right? Just because this patient wants to get 6 veneers, it's not always about the small gain, right? You got to think long term, and really it's about building a name and a brand for yourself as this guy knows what he's talking about. He educates me. He has an answer for all of my questions, and he's an honest person. I don't feel like this guy is just trying to make money off of me to pay for his car or his house. And he just, this is someone that I trust. This is someone that I want to, deal with. So really the success comes in your ability to just master understanding people and understanding human psychology. So these are all things that I can break down in more details. I mean, I could talk to you about hours for this, but I've actually created a specific framework that's 15 pages long in addition to courses. And I even have the offer for you to work one-on-one to help you really understand how to master this skill. It takes a lot of practice and a lot of awkwardness as far as like role playing, but role playing is the most effective way to figure out where you're struggling and creating a system for you that works, right? Because what works for me is not going to work for every dentist. So what I really try to specialize in is tailoring it to what you're doing and what your current practice situation is and the business model at the practice you work at. So if any of this interests you, if you're a new dentist, or even if you're about to become a dentist, just hit the link in the bio, join my community. It's completely free. We'll be giving a lot more details about the things I've mentioned. And yeah, look forward to seeing you there and talking to you guys. Thank you.